Thank you, Dr. Vohra, for talking to us today about global health. Please tell us, first of all, a little bit about yourself and about School of Surgery.
So my name is Ravi Vohra. I'm a lecturer at the University of Birmingham and also a surgeon at the Queen Elizabeth Hospital in Birmingham. As part of my academic vision, I have been looking with a group about how you can deliver surgical education slightly differently and using social media. So that made us set up a company around about 3 years ago now, which is essentially a surgical news channel which delivers the latest surgical news directly to trainees and surgeons from around the globe. It started off as an idea just to deliver surgical news to a group of trainee surgeons who were revising for exams, but with the power of social media, actually, it went global, and suddenly we had followers from all over the world, and we now have a editorial team made up of about 20 people who supply content, and we set ourselves up very much like a journal, but we're a completely not-for-profit organisation. We run at a slight loss, and we do it just because we actually see that there is a need in certain parts of the world for free education.
Yeah, so you're creating an open access resource for the internet?
Yeah, so I mean, we're basically curators, if you like, of what's available, because as I'm sure you're aware, when you Google or PubMed any term, you're left with hundreds of thousands of hits. The majority of them are not going to be useful for the majority of people in clinical practice. So one of the things that our editors do is they look at this and they basically look at what will affect their clinical practice. And we try to keep a very broad view of the sorts of people that are following us, and then essentially take that information and try to put it down into real bite-sized bits of information such that regardless of your geographical location, you can actually get that information. We are also aware that the majority of our users and followers will access this information on mobile phones and so we try to create content which is so small that regardless of where somebody is, they'll be able to get these bites of information.
Great. So tell us the big picture in surgery and outcomes around the world. What do you know about that, and what is the data around outcomes?
So when you look across the globe, there is a stark realization that outcomes vary completely, and that can be whether it is here within the UK and a suspect in the US. Even if you go a couple of 100 kilometers between hospitals, there is this huge variation in outcomes. When you look across countries, again, and continents, everybody is now becoming aware, and it's because of ease of access of information, that again there are this massive differences in outcomes. There have been a couple of studies, one published in the Lancet a couple of years ago, nicknamed ESOS, which tried to look at variations in outcomes across Europe. And again, they found this huge variation between country to country, which I don't think has everybody has thought that this was the case, but nobody's actually ever shown this as the case. And also, I think it's because of ease of access of information, such that we can now have conversations like you and I are, separated by thousands of kilometers, thousands of miles, but they actually easily have a conversation with anybody across the globe. So I think all these things are actually making everybody realize that there is this variation.
Mm-hmm. And the variation, as you said, happens a lot even within countries. And but if you look at variations across the globe, is there a correlation between wealth and poverty and
I think,
well,
I mean,
resources?
we all think there is. We all believe that that's the case. But in terms of what's actually available in terms of hard data, there's evidence from databases, reports, personal experience, and also what's evident on social media platforms and networks that there are a couple of studies that are within setup at the moment which are actually trying to address this specifically. But one of the problems with all these sorts of things is that people will only input data to these studies according to the availability of that information, ease of actually getting that data back. So it's a very interesting area because it ultimately comes down to how you access those places which are remote and otherwise inaccessible.
So if they're inaccessible, they may not. It's going to be hard to get data.
Yeah, and you're going to get a very skewed opinion of what's actually out there because the people that input the data are always going to be a sub-selected population.
Right. All right. So what factors come to mind that determine outcomes across the globe? Is it education? Is it hospital facilities? Availability of electricity? What are the sort of big ones that stand out among the data you do have?
I think as you sort of point out, there is issues with education. There is issues with geography, just distance to hospitals, distance, the availability within a certain centre of different specialists. Education is quite an interesting one because the access to that education has been made so difficult at times by different publishing groups. But actually out there, when you start looking at it, and part of the thing that we do when we look out online, there is a wealth of educational material that is available completely freely, but it's about knowing how to get to that information. Somebody is telling you, and that's one of the beauties of social media, is that actually the content that's delivered directly to you is basically picked up and chosen by your colleagues, your contemporaries, your friends and family, and we all put much more weight onto that's the information that's selected for us by the people that we actually trust and care about.
Yeah.
So actually, and I do personally believe that actually the data that's available out there, the information that's available out there, is much more easy to access and will be much more easy to access when Web 3.0 comes online. And having this ability to continually have access to data that's selected for us and information that's selected for us. But going back to your sort of question about what other factors are there, yes, access to resources are a problem, and also the movement of people. Now we're finding it much easier now to cross boundaries and work in different geographical locations, such that there has been a brain drain from places which are from lower middle income countries to higher income countries. One of the ex-presidents of the Royal College of Surgeons 4 or 5 years ago tried to address this. He himself being, I think, from Nigerian descent. We were going through a bit of an issue within the UK such that there were more doctors coming out of medical school than there were actually jobs. And in addition to that, the UK had opened up their borders to the European Union countries, such that there were at that time many more doctors than were actually required or were actually employable. And one of the things that this chap from the Royal College, the president at the time, tried to do was actually to restrict people with highly skilled migrant visas into the UK, such that they would firstly remain within their own geographical location and benefit their own people, but in addition also to help. But I mean, there were he was slammed in the media for what he was trying to do, but actually it was quite insightful what he was trying to do. He was trying to stop people coming into the UK such that he was hoping to keep them back in their own geographical location to benefit the people that had actually trained and taught them.
Yeah, yeah. I saw some pushback too. It might have been about that time from some of the doctors who did medical school in their own country, then trained in the UK or in the US, saying that the practice, the brain drain isn't a clear problem all the time. In other words, somebody comes from a less developed nation, they come here, they stay in the U.S., and yet they often will have interactions with their old communities. They send money home. They will spend time at home. I guess the argument the person was making was it still serves as an important cultural and educational exchange for the doctors to come, and I think he actually made the point that fewer people stay than I think most people believed. In other words, people want to get back to their homes.
No, I think you're right, and actually, it's one of the reasons that stops me going anywhere else in the world because of family and being close to family. I think it's like most of these things. Often the intent of most people is very good, but it's about how they actually deliver it, how they actually come across. But you are right that actually having these people come over here and educating us has added to the data, if you like, of knowing what's going on in parts of the world where we just don't know what's going on.
Right.
And actually training them up is the most important thing, and then getting them back to that society, that culture, can only be a benefit.
Right. So there's lots of organizations interested in global health, and there's some nice Twitter feeds dedicated to global health and even global surgery. Are there a couple of organizations that come to mind that you know a bit about their work and talk about?
Yeah, so I mean, there are three classes of organisations that are around the world. Ones which are devoted to education, awareness of the problem, and also about trying to generate data. So if we start with the generating data, as I said earlier, there are a couple of studies that are in setup at the moment where groups are trying to generate data and look at this variation in outcome across the globe. There are two in particular. One is called Global Surge, which is led by a group of trainees from here in the UK and the US, which are hopefully going to get medical students and junior doctors as part of their electives as they go abroad to actually collect surgical outcomes on patients, and very simple surgical outcomes like length of hospital stay and mortality. Just to see if we can actually see what the variation across the world is in very simple terms. Obviously, it will show complete differences in practice. We predict that it will show that. We also predict that it will show differences in mortality. But I suspect it will raise other issues which we weren't expecting.
Right.
There is another study, again run out of the UK, called ISOS, International Surgical Outcomes Study, which again is looking at this, but from an elective point of view, so looking at elective surgery, looking at the delivery of elective surgery around the globe. In both cases, they have around about 100 countries recruited, but as I said earlier, the people that will input the data will be the people that firstly have been able to access this information and so they'll become involved in the study, so it'll already be very skewed. In terms of awareness, an organisation that springs to mind is 15 by 15, so it is a multinational organisation with representatives from around the world which are trying to raise the awareness of 15 different essential surgeries by 2015. And part of their remit is not only to go to organisations like the World Health Organization and the United Nations to really promote several surgeries such as caesarean sections, hernia repair, cataract operations, but also to try to work with other organisations about education so that people, doctors in particular, actually around the globe have access to the educational content that they need. And that's where organisations like our School of Surgery, OnSurge, and other organisations really fit into that mould. We really have the ability to find the best content that's available out there, curate it, and then get it back to the people who actually need it and want it. And actually, one of the things when we've analysed our Facebook users, one of the stark realisations is that 80% of our users are not from high-income countries. They are from the lower middle-income countries. The people that share the content, the people that retweet it, the people that like the content, again, are not from the high-income countries. They're from the lower middle-income countries. Right. And when we have done surveys of our our users, again, it's really quite humbling, I suspect, to see the number of people that are actually not from those countries that you would think have ready access to this, but are actually from these other countries.
Yeah, yeah. You know, one thing that struck me as I was trying to, early in the days of trying to get resources out to low and middle income countries, is the realization that they don't have the internet in the way that even if they have access, they don't have internet in the same way I do. And, in other words, they may not have access to Twitter at all. Yeah. Or when they try to watch a video on YouTube, they don't have the plugin or the software that it is necessary for YouTube. I mean, these were huge presumptions I made, that when people had internet access, they had exactly what I have, from the standpoint of being able to use the web efficiently and access everything that's there.
Well, which is the reason why our strategy has always been the written word and actually using very, very small bite-sized bits of information. Mm-hmm. And that's the reason why Twitter actually complements that really well, because actually you have such a limited amount of space to put a message out. Mm-hmm. So actually we use that tweet, if you like, and reproduce that across the different social media platforms in a hope to get as much information out there as possible.
Yeah. So what would you say to people with a budding interest in global health and global surgery who are interested in making an impact or learn more about the issues in global surgery?
I think going to any of these organisations that I've spoken about and actually sort of just literally logging on and finding out what they're doing and just getting involved with these studies, especially something like Global Surge or ISOS. Both of these studies are really important to generate data. We make a lot of assumptions about what is different across these countries, but until we actually have the data and until we have the ability to compare that data, will we actually really know the size of the problem? And like I said, I think we will actually find that some places are not that far away than we actually think. And the other thing is, again, by having collaborators in all these different countries, it means getting the educational messages out, getting the awareness messages out becomes so much easier, because you will select champions within those countries who will really get that message out.
Yeah, great. Last thoughts, things you'd like to share about School of Surgery or Global Surgery?
I think I've shared enough, to be honest. I think I have, but I think the most important thing, and I think the overwhelming thing is, as hopefully has come across, is that the education is the really important thing. It's about getting people the latest studies about little things about for example hernia repairs or caesarean sections, cataract operations, these little operations which are actually life transforming, which some people just don't have the access to. There are other organisations really concentrating on how they get to the utilities out to these people. School of Surgery has always been dedicated to the education side of things, and it always will be. But we work really closely with other partners to make sure that we in our small part can actually have an impact. And we have a naive belief and central philosophy that regardless of where in the world you're admitted to hospital, that patient will have the same level of care delivered to them. And if there is variation, it should not be a variation because of the knowledge of the person that's treating you.
Fantastic. Well, I applaud you in your mission. And thanks very much for talking to us today.
It's been a real pleasure. Thanks for having us.
Take care, Dr. Vohra.
Bye.
Thanks for checking out the Op Report. Help us keep conversations alive on topics in general surgery. Check out more episodes of the Op Report and other OnSurge content here at YouTube. Find us at Facebook. Follow us on Twitter. And find our homepage at onsurge.com. Join the conversation and tell us what topics you'd like to hear about and what people you'd like to hear from.